Back. So let's talk about health. It's clear that in Nigeria we have this yawning gap when it comes to healthcare delivery services, and the private sector plays a major role in this. You hear that the hospitals in Nigeria, you hear about 60% of the services are being provided by the private sector, but we have one of the private sector players involved in bridging this gap in terms of medical equipment and the sort. We have this morning the group managing director of Alpha Mead Group, Engineer Femi Akintunde. Thank you so much for being here.
Thank you very much.
Thank you.
Nice to be here
today. Good to have you. So it is Alpha Mead Group. Yeah. That means you have other business concerns under that. But we're talking about Alpha Mead HealthCare management services. Yeah. Let's start from there. What are you involved in? Okay,
so thank you very much. Alpha Mead Group has three major lines of business. First is facilities management, which provides quality environment for people to live, work, and play. Corporate offices, commercial, residential estate. And we also now have a real estate development arm, which provides housing development, particularly affordable homes. And we build for government, civil servants, we build for people in the middle income bracket. We are doing some things for building about 1,000 for Enugu State currently. Then we have a vertical for healthcare management, which primarily looks at the healthcare space and identify gaps in terms of delivery. What is not making healthcare work well? We provide solutions to that, and that's what the healthcare arm of our business focuses on primarily.
So what is that major thing you think is not being provided in the healthcare sector in Nigeria?
Right. The starting point is for us to understand one thing that says that health is wealth, but wealth without good health is hell. If you're healthy,
wealth without good health is hell.
You better be poor and not have good health. Now, when you are very rich and you don't have good health, then you know that it's living on earth as if you are living in hell. So whether somebody is rich or somebody is poor, all of us, we need good health to enjoy life, which is God-given. And we have discovered that a lot of simple medical cases get escalated and become very complex by the time people get access to medical solution or medical assistance. But doctors will also tell you that accurate diagnosis is more than half the cure. For us to achieve this accessibility problem, we need to make healthcare available to everybody and make it affordable. Because if it's available and it's not affordable to me, I can only look at it, see it, I can't enjoy it. So that is the solution that we are trying to bring to play. We believe that Nigeria has a major problem with healthcare. And that problem can be connected with the state of our healthcare facilities. Number one, they are not enough. Number two, they are not within the location that ordinary people can have access to it. And number three, that's what I mean, they're not adequate. They are not accessible to people where everybody needs it. Number three, is that even where they're equipped, the equipment are not in good functional state. And to deliver quality health care, it starts from you being able to understand what is wrong with you. So our people today, they delay going to the hospital because it's far from them and it's expensive. So they take to self-medication. And the self-medication results in complications that makes it more expensive. So I say that affordable healthcare is not necessarily about getting healthcare service that is cheap. It's preventing the problem before it gets complicated. If you prevent malaria before you have it, is cheaper. When somebody
Than
has
treating
cancer,
it.
yeah, and it's still at stage 1, the cost of treating it at stage 1 is not the same thing as treating at stage 4. Stage 4 is as expensive as losing the life. So we are saying that let's address the problem of accessibility to help our nation manage the inadequate resources that we are deploying into different infrastructure by helping people, taking healthcare closer to them to prevent problem from aggravating. Then we will discover that we spend less. But when you don't plan it very well and you don't have the services close to people, it will be very expensive by the time you discover.
We can see on the screen, I think this is your facility and some of the equipment there, I guess.
Yeah.
Yes. So, Mr. Kitude, how are you intending to do all this?
Right.
Because I'm looking at it as a very big task. You're talking about Nigeria.
Yeah.
And you have healthcare management services. You only have one office, maybe either in Lagos or Abuja somewhere.
Yeah.
But you're seeing the big picture.
Yeah.
You're seeing Nigeria.
Yeah.
So how do you intend to do this? Bring healthcare closer to the people, all people in Nigeria.
Thank you very much. That's a very interesting question. As an entrepreneur, we don't see problem. We see solution. That's what excites us. If we look at it from that perspective, it will appear as if it's overwhelming, but it's not.
It's onerous, yes.
It's not in the sense that there are sufficient systems that has evolved that makes that task very simple today. And I always believe that it's only Africans that can provide solution to African problems. To the extent that if we continue to import solutions from advanced countries where their own environment is already prepared to make services available in a particular way and format, we can't use it here. So with big hospitals, you have general hospitals, teaching hospitals. How many of it can you have all around the country? Ikorodu, Ekpe, Bagada, Badagry. You go to Shogbo. How many general hospitals can you have in every community, every local government? You can't. But what we are saying is that those fixed structures, let's have them where they are. We have come up with the concept of modular healthcare facility, which is called MHF, which is the picture you saw there. The concept is that let's break down healthcare into smaller modules and gradually scale it up. So each of the module is like a cabin, 8 by 4. Looks like the size of a container, all right? So we're saying it starts with the first module, which is a basic module for primary healthcare. It starts with a small admin area, waiting area for people, and a tele-consult. So the idea of the tele-consult is that anywhere you can use telephone, we can use the bandwidth there to connect anybody from any village in Nigeria to the city center, where you have the best of the consultants. You have eliminated 2 problems. Problem of transport logistics, problem of timeliness of intervention, and problem of accessibility, that the person knows that within 5 kilometers from me, there's a small cabin that I can go to and access the best gynecologist available in Nigeria anywhere. And guess what? One thing we've also discovered is that Nigerians in diaspora, because people keep saying, oh, Nigerians are leaving Nigeria, medical doctors are leaving. Sorry, there's very little you can do to hold people back where you're not providing them with enabling environment to function properly. But we're saying, even if you leave, you're still a Nigerian. By connecting to technology, I'm able to access the best Nigerian doctor that is located in America to provide service to that old woman in Odiomu village through technology.
Okay, so you've talked about bridging that gap in terms of diagnosis or clinical diagnosis, so that even if you are in Osun State, you are able to connect, for instance, with a consultant who is in Lagos.
Definitely.
So after the diagnosis or the clinical diagnosis, what happens next?
Okay, so the diagnosis is the starting point. And our module has the radio diagnosis and has the laboratory analysis. So when you go into that place, everything that the doctor will do for you if you go to the big hospital can happen there, because that's the starting point. Laboratory can do up to 650 different analyses, from the blood test to chemical to everything. And the radiodiagnosis starts with the X-ray machine. And the X-ray result, when it's taken, can be transmitted through what we call radiology information systems, and also PACS, which is the picture archiving and communication system, right? It transmits that message, that picture that you've taken, to the radiologist in the tertiary hospital general. Once he sees it, he will read the problem and he can prescribe to you what will be the solution to the problem, because it's as good as you standing or visiting him physically. So once he prescribes, our system also has what we call e-prescription system. So chemists are registered on the system, on that technology platform. So when they prescribe to you, you don't need to come and collect the medicine in the hospital. You go to the nearest, the system will check the nearest chemist to you to go and pick your medication.
Even in Odeomo, that you use that
as long as there's a chemist there. It's our job to organize those people, the supply chain, that within a distance of like 1 hour from you, chemist that is there, you can go there and pick your medication. Because as long as the person can use telephone and we can transfer money, everybody does electronic banking today. So technology has made it so easy to make the world a global village. So from the basic of our model in the village, we also have the one that we call the excuse me, secondary healthcare. That one has the X-ray system. And then we have MHF3. It has the combination of the laboratory, the telemedicine, the radiology services, which is the X-ray, but it now has what we call the computerized tomography, which is a CT scanning system. It's a 64-slice CT system. When you enter the machine, there's a rotation. It takes 64 slices of your body and forms an image that allows the doctor to know what is wrong. That's what you use to detect cancer. So when cancer is still at stage 1, the man in the village doesn't need to come to general hospital or tertiary. It will be discovered early, and then they tell you exactly what to do. Then we have an advance, which is MRI as well.
So how many of these are available in the country now?
So we just did the first prototype, which we display at Badara General Hospital. And right now, we have capacity to produce up to 1,000 in a year, right now. And the patronage is rising. It was launched on June 26th by the Vice President, represented by Mrs. Orelupe Adejoke Adefolure. She was the one that represented it. And yesterday we had a meeting with Ghana HealthCare Service, because Ghana is already interested, and they're going to be placing large orders.
No, I think you have your work cut out here. No, let's face this place first.
Nigeria first.
Because now I'm wondering, okay, you're going to make all this available.
Yes.
Are you prepared for the amount of awareness that you have to create so that people actually go to these containers as you have described them, instead of rushing off to the capital city to go to the hospital?
I am extremely delighted that you mentioned that, because that's another problem we've just solved. What you discover is that when people have ordinary headache that can be treated at the primary health care, they rush to the general hospital. The teaching hospital is congested with minor cases that would have been treated at source. So our solution, because it's nimble and small, we will reduce the level of crowd in the general and the tertiary hospital. So the awareness is going to rise the more we can deploy, because we've made it cheaper if it's available. We can deploy this in smaller units to different locations. Our primary health care system is not working now. Even when they are there, the grass is overgrown in those places. People don't even go there. The fact that I'm poor doesn't mean I don't know what is good for me. Nobody wants to die. So they don't go there because it's not functioning. The workers are there being paid salary, but they're doing nothing. So what we are saying is that Nigeria needs to understand that we need to start from somewhere. So when we do that, another good thing is that it's able to connect data because we have what we call electronic medical records with it. One of the problems of our healthcare planning today is that we don't have sufficient data. So the system is wired through a network that gathers data of the type of ailment people are bringing. So implying our healthcare and allocating budget resources, it also makes it very easy. This is part of the awareness we're raising. The Ghana board that contacted us, they saw it on digital, on the platform, on the system. They want to build 111 hospitals in 18 months. And people told them it's not possible. Until somebody saw our solution and said, look, this is the solution to your problem. And they called. We've had 2 meetings with them already. Nigeria, we've met with the minister, Honorable Minister of Health. We've met with the SDG Special Assistant to the Presidency. We've met with the Commissioner for Health, Lagos State, he has visited. Commissioner for Health, Ogun State has been there. We've contacted every single teaching hospital all over Nigeria. Over 800 communications have gone out. Our communications department, they've been working around the clock to make sure people see this. And we've used our money to build it because a lot of Nigerians have ideas. But if you don't bring it to reality, people don't know what you have. It's on paper. But what we've done is that when we finish the design, we put money behind it and we partner with the best. We partner with GE, General Electric HealthCare. So we have it on grant. People can visit it at Bagada to see what it looks like and feel.
Okay. What plans do you have for maintenance? Because you know when it comes to maintenance, we have a bit of issues around that.
That is our bread and butter. I mentioned that our business, primary business is facilities management. That's what we've been doing for almost 15 years now.
And you're an engineer.
And I'm an engineer by background. But that's the interesting thing about engineering. You can apply engineering to solve many humanity problems, right? So we have a team of biomedical engineers, but we also leverage technology for the maintenance because these units, these modules are interconnected. We have what we call the computerized maintenance management system that predicts the different things you have to do at different times, inspection on daily, weekly basis, and then we resolve all the maintenance issues.
Thank you so much for sharing all of this with us this morning, and we're hoping that, you know, all those who should, look into this will make sure that they do so that we can bridge this very wide gap when it comes to healthcare delivery in Nigeria. We've been having a chat with the Group Managing Director of Alpha Mead Group, Engineer Femi Akintunde. Thank you so much.
Thank you very much. It's a pleasure being here today.
Thank you.
Thank you.
We'll take a quick break now. When we come back, we'll be talking about insurance. Just stay with us.